working on the COVID-19 containment and mitigation plan. This coordinating team is a work stream of the Provincial Disaster Operations Center, which reports to the Provincial Coronavirus Command Council. We have engaged the National Department of Home Affairs, Communication and Digital Technologies Department to work with them in improving service provisions at their service centers in our province. And this is where we are very much concerned. The current queues that we see in Home Affairs are not good for our people, and we are trying our level best to mitigate and manage those queues. We'll be using our EPWP officials as queue marshals to help us manage and make sure that people sanitize. But the Department of Health, Department of Home Affairs, has acknowledged its weaknesses, and we are trying to work with them and with the Minister to address those kind of problems. Some of them are structural, some of them are human resource related, and we believe that we do have a lot of low hangings that we can easily address to ensure that we manage the situation much better. Similarly to the post office, we are working with the both provincial and national office to ensure that we deal with challenges that have been actually presented out of that. And the COVID, so the post office as well as the Department of Home Affairs, they've actually collaborating with us, and we're targeting our big offices like in Mthatha, Nelson Mandela, and Queenstown, and East London, where we seem to be having problems. Because part of the problem is that if those other small offices in small towns are not functional, then you'll be forced to actually absorb numbers that are coming from those small towns into bigger cities. This is what you see in East London, that people are leaving all the other areas, coming into East London, hoping that the situation there can be actually much more better and efficient. Yes, we know our offices here have been working very well before this. We knew that you can apply for an ID, in 2 weeks' time you get your ID card. So we should be able to get that back and improve the system, as we have indicated. In all of these service centers, we want to ensure services are provided to the people of our province in a safe environment so that these service centers do not become super spreaders of COVID-19. Government is improving service provision so that people don't meet at these centers in big numbers. We have noticed that many people who go to Home Affairs leave service centers in their own towns and go to East London. Hence the high numbers we see at the service center. We plead with our people to go to Home Affairs offices or service centers near them to get services. When it comes to SAPO, they've developed a new plan to manage the queues in their service centers, and they have increased number of people to receive 350 grand. We looked into what caused long queues at the post office branches across the province. We're improving personnel, technology capacity and communication with clients to ensure that people come for appointments to collect their monies and not stand in queues in the current manner. Daily transactions data shows that the capacity to process the current queues is available at SAPO. The main problem is the time that beneficiaries have to wait in queues, thus increasing their potential exposure to COVID-19. SAPO will be meeting with SASSA to further engage on the proposed areas for consideration next today. Our State Information Technology Agency, SITA, is part of a collaborative effort to address the existing pressures as evidence in the commitments already made. As government, we will provide EPWP workers to assist the post office branches to manage queues as we are doing it with Home Affairs. COVID-19 health and safety protocols is also in place to support markers, including the mitigation of infection on markers who declared comorbidity risk in all our marking centers in the province. There are 7,786 members of marking teams that were tested COVID-19. 292 tested positive and are mostly out of the isolation period. Replacement markers came with the negative results. All visitors staying more than an hour brought negative COVID-19 results. Marking teams staying outside of the centers are in red areas. There is no outbreak noted in the marking centers. All marking centers have appropriate PPE and marking is on track for completion by the 22nd of January. With regards to the opening of schools, we all know that the Department of Basic Education has pronounced on the revised date for opening of schools, and schools will now open on the 25th January for teachers and 15th February for learners. The Department of Education in the Eastern Cape is now in the process of the revision of the risk-adjusted reopening of schools readiness plan, which includes the key elements of socialization of the education system on COVID-19 protocols and hygiene standard, interface with the Department of Health for COVID-19 support, PPE decentralization provisioning and monitoring, interface with the Department of Safety and Liaison to support school safety programs, interface with the Department of Social Development with psychosocial support, approach to scholar transport benefit, approximate 120,000 learners, hostel support program, which is long-term, school nutrition, which also takes a decentralized approach. While we continue with the mass testing in our province, we are also gearing ourselves for the vaccination program. The success of this program depends on the hands-on approach by all of us in the province. We call on the people of our province in their sectors or positions of authority to support this program. The vaccine is safe and has been tested to ensure its safety. We will never distribute vaccine that is not tested and that is not safe to our people. We have to achieve herd immunity to defeat this virus. Thank you very much.
Thank you, Premier. We will now take questions from members of the media. Let's start with those that are here, and then we'll check with those that are joining virtually. Okay. Let's start with you, Mr. Dada. Now you can speak from where you are. Use your shop steward voice.
My first question is directed to Premier with regards to the vaccination. How are you going to ensure that this process is running smoothly and no corruption, no issues of corruption? As you might know that in the past there were issues relating to corruption. And the second question is directed to the SABC of the Education Department, just to find out if there is a succession plan and to fill in the vacancies of those teachers that have been supposed to.
Okay, thank you. Thanks. Okay. I'm yet to get questions from this side. I'm missing Kale now.
Thanks, Program Director, and thanks, Premier. Good morning. Good morning, colleagues. Ever since the advent of the COVID-19 in the country, the DBE has actually created a space for it to make an adjustment strategy that does not just talk about the teaching and learning only, but also talks to the human resource placements and migration. So basically, we have made an audit. Of those that have been highlighted by the ministry nationally, that are above 50 years, and also made an audit of those that have got comorbidities, but equally important, make an audit of those that have passed away generally in the province, and then created a dispensation of the young people that must then get into the system itself, so as to energize the system in education, but also give opportunities for them to learn through the processes that we have been putting in place. The fortunate part of the Eastern Cape DPE is that for the past 8 years or so, it then introduced 2 categories of aspirant educators via the Funza Luchaka program and also via the Matthew Goniwe bursary scheme and bursary program, so that we can be able to balance up the demand and supply of the province. So in essence, we are ready. We have already started that process of ensuring that when they come back on the 25th, we are closing up those spaces of those that have actually passed away. May their soul rest in peace. But equally, our challenge, which is not a challenge, so to speak, but it's a culture, I would say so. It's a culture in the sector itself, that the migration generally of the population in the country feeds directly to what you can then begins to say are the prospects of what is going to happen in education generally in the country. So in as much as we have dealt with the issue of the admissions and close it now, but I can assure you that come 25th, when the schools are opened, you will get some of those few individuals wanting for their learners to be enrolled as part of the learners in the province. But generally was stabilized, and we've been able to ensure that we close the academic year of 2020 on a good note, especially from the current developments of the marking and examinations, which is a critical question, whether are we progressively moving forward as a country or not, but equally align that with the school readiness report, which we will share with you when we finish it on Thursday, because we wanted to make sure that when they finish up the marking program on Thursday, we then issue out what is contained in that development, and how should we then make the approach moving forward. Thanks, sir.
Can you take a question online so that you can respond to Zong? Thank you, MEC. We'll now go to JJ. 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 Okay, there's a question about Nelson Mandela from Cape Premier. But is Nelson Mandela still a hotspot given in numbers? We can respond to that later on. I think what JJ is unable to unmute. JJ, can you speak? Yeah.
Let's come out of that to take you to that breaking story. The government employees, medical schemes and the Board of Healthcare